All right, so Karen, we're going to do a isolated neck lift under local freezing today with a combination of radiofrequency technology, VASER technology, and lifting muscle and lifting the skin. So our game plan is to get a nice change in that angle of the jaw and actually not only change the quantity of skin, but the quality with the radio frequency. Now there's some little
Okay. Hi, welcome to another episode of Sisterhood of the Scalpel. I'm Dr. Maryam Zamani.
I'm Dr. Julie Khanna.
And today we're especially excited to talk to you about a procedure that's actually very unique to us, what we offer here at ICLS, and that's our approach to a mini necklift. And this was a brainchild of my partner right here, Dr. Khanna, but it's something that we both practice and we both do a lot of in our practice. And it helps to provide good treatment for patients who want to improve their jawline. This is something we're looking at so much throughout our daily Zooms. You know, every time we're constantly looking down, we're seeing all the sagginess, all the buildup, the loose skin. It's becoming a bothersome area for a lot of us. And so we want to talk to you about this treatment that we've devised that allows us to get you going with minimal downtime, performed under local freezing and laughing gas for your comfort. So something that we can do easily. The recovery is quite straightforward. And it's something that incorporates two of the things we love to do here at ICLS. One hand, it's obviously the basic principles and tenets of plastic surgery, our bread and butter. But on the other hand, we incorporate a lot of our technology into this. So we bring a nice marriage of the two together to give you the great results with minimal downtime.
Well, you know, I think it's a marriage. You're right. It's like 1 + 1 = 3. And for the first 15 years of my practice, I never did necklace because I hated them. I said, nobody's happy. What they want is a facelift. They want that big pull. And if you do just a little pull, it's not enough. But when you combine it with technology, you get 1 + 1 = 3. So what are the layers? So we'll go through. First thing we do, 3 little needle holes, and we freeze, freeze, freeze. And I want to point out, lip line to the first neckline. This is the zone we're dealing with. Okay. If you like this look looking up at the ceiling, that's a facelift.
Or if in a mirror, the other thing I always tell my patients is if you look in a mirror, if you're doing this in the mirror and this is what you want, you're a good candidate. But if you're going in the mirror and you're pulling up on your cheeks all the way to try and get this fold straightened out, we're talking facelift for you. So just
Oh, well, wait a minute. But I got to say that if somebody pulls here and they pull so much that it's all like all gathered, okay, 1 centimeter. Guys, don't listen to what the boys tell you. Measure it out. What is 1 centimeter? And if you put 1 centimeter on each side, you like it, especially the shape of it, then that's a good operation for you. So we put the needle holes in. We froze up. What's our next step, Dr. Z?
So what this is a small little pencil-like device that goes underneath the skin. And we're using 2 types of energy here. First, we start with our ultrasound, part of what we call our VASER. That shakes everything loose, starts with a little bit of heat energy. We start to get some of that tightening. We say up to 13%. But really for our patients that need the mini necklift, we also want to recruit more for your own skin to tighten, for your own collagen to build up and strengthen. And so on top of that, we use a second device that's called radiofrequency. You may have heard of it as face tight, neck tight, body tight, Aki tight, all the tights. We have all these devices. We use the one that's right for your skin type and what your skin needs from us. So we go ahead and we treat exactly what we pointed out, from the corner of the mouth to the ear to the first neckline, because those are our safe zones. And they're also the areas that give us the most bang for our buck. And so we start with that treatment. Once we're done with that, this is where next our surgical side comes in. So in order to do that,
we forgot. We always do a little bit of lipo.
We always do a little bit of liposuction. Some of our patients,
a little pooch, or the big jowl, or the big pooch, whichever it is. We do deal with it at the same time as well. Between those technologies.
And not everyone needs a whole lot of liposuction.
No.
We have a lot of skinny neck patients, and for them, it's just a little bit of finesse. So we combine elements of what we do in our facelift surgery, we borrow that, and we incorporate this. So a small scar that starts from just in the crease in front of the ear. If you look at your own earlobe, we usually have a little bit of crease from the extra skin that we already have. That goes behind the ear. That's it. This little scar, we use it so that we can access underneath, and we put muscle tightening stitches. That's what we really want, because that's what's going to give the lift to the jowls. When you're doing this, you're putting your hand on your finger on the corner of your jaw. And when you're pushing, what you're really doing is you're pulling that muscle, and that's what's translating to the tightness you see here. So we do that surgically on the inside, couple of little loops of sutures that eventually do dissolve away, but which cause that permanent tightening we like to see. And that gives us that nice contour of the jawline and pulling on the jowl that skin, all the skin tightening devices alone can't do. That's why we need both sides of it.
You add them together, right? You keep adding a little bit more and a little bit more. So your Vaser gave you the skin tightening. The liposuction improved your shape. Radiofrequency added more skin tightening. Now you're pulling those muscles. Now you're taking 1 centimeter of skin. And
Yeah.
it's really important, because that's a really good way to understand the limit of this. Because if you ask me the number one risk of this operation, it's not a facelift. That's the number one risk, because everyone's going, go ahead, do everything. But it's not, but it's a great result. And you can see some before and afters here. And the downtime is so reasonable.
It is. Really what we see is our patients come back. Really just 2 weeks is when I would say is our big recovery period. During that time, you're going to have some swelling, some bruising. That's the part. And we're going to have some chin support to help with all the swelling coming down. But after the 2 weeks, when all of that bruising and swelling starts to settle, you start to see the contour. You're able to go out. There might be a little bit of ruching behind the ear, but if you have nice, long hair, you can just contour it so that shape it so it falls and covers everything. Even if you have short hair, little wisps that go behind your ear is all you need. This is a procedure that builds upon itself, because it's not just the surgical results that you see the immediate payoff on, but it's also the technology. The technology uses your own body's method of healing to create that extra collagen to make your skin essentially younger. That doesn't even kick in until the 6 weeks after surgery. So everything we see, we're seeing immediate results. And at 6 weeks, your body takes over and keeps building and building and building for a whole year. And we can see up to 30% skin tightening on top of what we've already achieved with that. It's a perfect treatment for those of us that want to get that nice jawline contour. We're seeing those early signs of aging. We want to try and set back the clock. Patients come and ask me about this procedure all the time, and they ask me, okay, are the results permanent? Yes, the results are permanent. Everything we do with facial rejuvenation, the results are permanent. What we're doing is we're taking the arms of the clock, the hands of the clock, and turning it back. So on average with this procedure, it depends from person to person, but about 3 to 5 years setting you back in time, sometimes even more radically, depends on your jawline. But the second we stop the treatment, of course, time keeps ticking away. We have not figured out the magic potion of youth yet.
Moving to Mars. We know that's
So, of course, signs of aging will still continue to happen. We'll still continue to develop loose skin, but that's why investing in your skincare, investing in your rejuvenation methods, investing in your upkeep is going to be what's going to be the key to success to making this last even longer than you would otherwise.
So we combine it, you're right, with skincare, Botox, and filler, because then we can deal with the upper face that way. So it's pretty exciting. We think you're going to love it. We've got some before and afters here for you to see as well. And if you have any questions, don't hesitate to ask either one of us or any one of our team.
We're on a mission to improve necks everywhere.
It's the Zoom lift.
It's the Zoom lift. The Z lift? All right, it's been our pleasure. This has been another episode of Sisterhood with Scalpel. I'm Dr. Maryam Zamani.
I'm Dr. Julie Khanna.
And we hope to see you very soon. Bye.